Welcome, ladies and gentlemen, to episode 4 of Beyond the Surface, a Psoriasis podcast. I'm Sophia Lowy and I'm honored to be your host today. The impact of psoriasis on a patient is not measured only from the direct cost aspect, though this is an important aspect, but also from the poor quality of life and loss of productivity. Not much is known about the cost impact and quality of life and productivity losses arising from psoriasis. To shed some light, today we have Dr. Azura, consultant dermatologist from Hospital Kuala Lumpur, Joyce, a psoriasis warrior, and Dr. Peter from Gleneagles Hospital Kuala Lumpur. Welcome to all of you to the show today.
Hi.
And over to you, Dr. Azura.
Hi. Thank you, Sophia, for that kind introduction, and thank you again, everyone, for availing your time to be with us to discuss on a very important topic. We're going to talk about the economic burden of psoriasis. Okay, so when we talk about the economic burden of psoriasis, I think we look at the public sector and the private healthcare sector. It's a bit different in terms of the funding that we have. Okay, so if we talk about the cost of illness, the cost of funding the treatment in a public hospital, of course, it's heavily subsidized. Even though the patient only pay a small fraction of money, they get exactly the same treatment like what they would get even in a private hospital. But it's just that because in public hospital, we have more patients, the waiting time to see doctor can be quite long. They have to wait several minutes to even hours in order to see the doctors. Okay, but if we talk about the cost of treatment itself, because it's subsidized, the patient don't actually see what is the actual cost. Okay? They just pay, for example, to see the specialist, 5 ringgit, and they get a lot of topical treatment. So what they perceive is all treatment only costs the amount that they pay, okay? But it's actually subsidized. So the creams that you get to treat, it's not 5 ringgit, it's definitely more than that. And the oral medication, some oral medications, they're actually quite expensive. For example, if we talk about cyclosporine, the cost for treating patient with cyclosporine in a month would reach between 1,000 to 2,000 per month for each patient. Okay, and of course, biologic, the latest treatment that we have in the market, it is efficacious, but it's not cheap. The cost of treating one patient with biologic, depending on which type of biologic, it can range from 20,000 to even up to 40,000 per year to treat one patient with biologic. And imagine we have to continue that annually and for several number of patients. So the cost is heavily subsidized in the public setting, even though we will try to offer more patients, deserving patients. They are eligible to be treated with biologic, but unfortunately, because of a cost issue, we are not able to support all patients that with the treatment. Okay, so we have several means. Okay? For example, for those who are working with the government, we will go through the funding from JPA. For Muslim patients, we have zakat that could help them. And then there's also tabung bantuan perubatan for patients who are in the B40 category. So those are the avenues that we can use to help our patients if they need these more expensive medications. Peter, would you like to share your experience in terms of the costs of treating patients in a private care setting?
Okay. So I don't just see rich patients. I still have my poor patients. So patients that come to me, generally we divide whether it's cash paying or whether under insurance. So the insurance can be from corporate insurance or personal insurance. So for insurance, it's more straightforward, especially the corporate insurance. Most of the time, if they have no limit, then our management will be simpler. We will try to give the best for the patients. But of course, some even corporate insurance, they have their budget, their yearly budget. So we have to discuss with the patients what is the best option for them. Now, as for cash paying patients, then it depends on affordability. So if those who cannot afford, I still tell them, we can't just give up on you. There are still other options available, even methotrexate I still use methotrexate. I think all of you know that methotrexate is something very affordable, but we need close monitoring for that. Or if patients still find it hard to afford, then of course we will be more glad to write them a referral letter to the government hospital to continue to follow up. I always tell them, now we have diagnosed it, let me write down a plan for you, and you bring this letter to the government hospital. As for what treatment, I can't dictate it. Of course, the most costly medication for psoriasis we know is biologics. So for biologics, like Azura just now you mentioned, it's between 20 to 40,000 a year. Of course, some of the biologics company nowadays come up with all this patient assist program, and so some will be able to help the patients to reduce down the burden of the cost.
So you mentioned about referring a patient to the government hospital, but the thing is that the treatment that we can offer is probably about the same like what you can offer. But I do understand for those cash-paying patients, it's not easy for them to continue the treatment in a private hospital. But what is your opinion regarding, because we know some insurance company, for example, they would cover the treatment while the patient are admitted, but it only covers for several months. 3 months is the usual amount of time that it will cover. But once they are back into the outpatient, it's not covered. So actually, it's quite a hassle for us to maintain the continuity.
Correct. So I totally agree with you that I discourage that kind of admission unless patients is really like erythroderma, very severe psoriasis that I need admission. Otherwise, if it's just admitting for biologics, I always tell them, there's no point in it. You can't be admitting every couple of months for biologics. And I don't want to clear your skin and then after that you default and then you have a flare of psoriasis. It's like, bringing you up into heaven and then pushing you down to hell. I don't like that. So
so you just have to be a bit realistic in terms of when discussing the treatment options.
Correct.
So let us get the perspective from Joyce, who is also our psoriasis warrior. So Joyce, tell us your experience in terms of the financial burden for the treatment.
I have been having psoriasis for the past 30 over years. So my initial treatment I get from the government. I have full support from the government. All the traditional treatment has exhausted and come to the last resort. I have to get the biologics because I suffer a very severe form of psoriasis. Erythrodermic come with pustular, generalized pustular psoriasis. Government supported me, but the situation does not allow for a permanent support due to some limitation. So I had some support from my corporate insurance from my company, and from there I able to continue my biologics treatment. But again, there is loading. Every time when you have a claim from the corporate insurance, the following year will be subjected to loading. So our HR will review the situation, and sometimes it may be a financial burden to the company. So it may not be a long-term support also for the corporate insurance in order for patient like me to have the permanent support. So I even seek other channels like tabung, and also the last resort probably withdrawal from our account to EPF to support with the biologics treatment, because withdrawal of biologics will actually lead me to a very severe flare, which I cannot imagine, because my flare will cause me to disability. When I was admitted, my condition will be very bad. I will be bedridden, and in terms of productivity, I cannot work. I've been absent from work for 2 weeks in the last 2-3 months because of the severe flare. So when it comes to our productivity, we are not able to contribute also to our company, and therefore we might be discriminated also. So we do need financial support from other channels, not only apart from the corporate insurance. So for me, I continue to see our public hospital with close follow-up. I get all the medication, the cream. Doctors are very supportive. They always attend to me whenever I have my flare, and they also bring my appointment to a closer date so that I don't get any fallen out from the medical follow-up. So I really appreciate that. But because of psoriasis is a lifelong disease and I need a lifelong follow-up, I also need a lifelong support, which I am not able to afford under my own financial situation. So we need support from other channels as well.
Okay, Dr. Azura, we know the cost of the biologic is pretty high, but if you look at the long-term cost effectiveness analysis, so despite it costly, the benefit that society gains outweighed the actual cost. What do you think about that?
Yes, as you rightly pointed, we know that by now that biologic is not cheap. It's quite expensive, as we've already mentioned. It can range between 20 to 40,000 per year to treat one patient with psoriasis with biologic. So it's not cheap. But we cannot look at the cost factor as the only determinant of whether the treatment would be benefit to the patient or not. Because as Joyce, you shared your story and what you had to endure. You had to be on MC for several, and I think that's not just the only episode, right?
Yeah.
There are several times where you had to miss work and miss a job opportunity. And this one is, we're talking about the employment state. What about the time with your family? If you're having a flare, you cannot give your full attention to your family. So those are the things that you may miss out. So we cannot just look at the cost factor alone when we decide what would be the best or the appropriate treatment for the patients, because studies have shown that even though the cost is a lot, that the benefit that the patient will gain outweighs the actual cost. Because once you are better, you can contribute more to the society. You can work, you don't have to miss work, you can give more attention to your kids, you're happier, and it also indirectly will help reduce the comorbidity, because if you're on the correct treatment, the inflammation is reduced, the chances of getting the other comorbidities like depression, like GI, for example, liver side effects, so those can be lowered, and you don't have to seek attention from the doctor to treat all those comorbidities. So we cannot just look at the cost factor alone. So we need to look at what are the benefits that the patient will gain, and definitely it will outweigh the actual cost in the long term. So what do you think, Peter? Do you think that is
I totally agree with you, Azura.
We should look at things?
Yeah, but I think besides that, I think, Joyce, you had generalized pustular psoriasis, and we know that is a life-threatening disease. It's a life and death thing, If we don't address it urgently, of course, there's high mortality there. So it's a life there, that we are dealing with, not just skin deep, not just aesthetic of it, but it's a real disease. So that's why we look at severity of psoriasis, not only by the extent of the rash, but also how it affects the quality of life of the patients. And what Azura mentioned just now, your work, your life with your family members, your sexual life, how you dress, how you go out, interact, socialize with your friends, and all these are very important. Right.
So the thing also, it's the indirect cost. For example, if your disease is well controlled, you will visit the doctors less, there will be less hospital admission. So all those hospital admission, hospital visit actually incur costs. It's actually something that one may not see in terms of costing. They just look at the cost of medication, but the cost of admission is actually very high, not just in terms of the hospital bills. You'll be out of work. So all those costs actually added up. So in the end, in the long term, it's actually more beneficial to control the disease so that you're able to contribute to society more. The society will also gain from your contribution to the society.
Yeah.
So that's how I think we should look at any chronic disease, not just psoriasis, any other chronic disease.
Yeah. Cost of transportation, going in and out from the hospital and go to the clinic to visit doctor. Cost of doing the investigations as well.
Yep.
Because other systemic treatments, we may need to monitor your blood tests very regularly. And also the potential side effects of those non-biologics treatments we'll talk about. You know, example, liver, we need to monitor your liver function test. Azura mentioned just now cyclosporine, we need to monitor your blood pressure, your kidney.
Yeah. So all that will add up in the end.
Yep.
Yeah.
Yeah. We don't want to be treating your complications later on. Once you have a liver damage and everything, then we need to refer to the hepatologist. So another referral, another cost to it.
Okay. Thank you, Dr. Azura, Dr. Peter, and Joyce for sharing this invaluable sharing on today's episode of Beyond the Surface, a Psoriasis podcast. It is clear there's a high economic burden in treating chronic diseases like psoriasis. We have to ensure there's no one left behind in the provision of effective treatment for this condition. For support or more information, please drop a message at our Facebook and Instagram, Psoriasis Association of Malaysia. Thank you for joining us on this episode of Beyond the Surface, a Psoriasis podcast. And don't miss the next session and see you soon.
Bye.
Bye.
Bye.